So we finished last class with the conversation about various Enterobacteriaceae, commensal microorganisms found in the digestive tract of the humans. And we're moving forward to other bacteria, and we're going to be talking specifically about two primary intestinal pathogens, Salmonella and Shigella. So Shigella is a causative agent of digestive pathology known as shigellosis. It has a variety of virulence factors, from adhesins that facilitate adhesion to the epithelial cells of the gut, to Toxin that inhibits protein synthesis, causes the death of epithelial cells. Now, different species of Shigella have different geographical distribution. For instance, Shigella sonnei is more common in the developed countries, while Shigella flexneri is in developing countries. Now, what are the symptoms of shigellosis? Watery diarrhea that eventually transits into the dysentery. The definition of dysentery is pus and blood in the stool. On this micrograph, you can see white blood cells, bacteria, and red blood cells in the stool of a patient with shigellosis. The main problem associated with the Shigella is so-called hemolytic uremic syndrome, the one that we mentioned on Monday when we talked about enterohemorrhagic E. coli. And that relationship between enterohemorrhagic E. coli and Shigella shows how easy the genes can be transferred even between different species of microorganisms. Toxin was initially discovered in Shigella. Then at some point of coevolution, E. coli acquired the genes for Toxin from Shigella and, came pretty close in terms of the pathogenesis to Shigella itself. So how many cases of Shigella happen every year in the United States? We can kind of estimate. This graph from CDC shows you the number of shigellosis cases, registered, reported shigellosis cases in the U.S. So you see that on average it's about 10 cases per 100,000 population. If we presume that current population of the United States is 300 million, it gives us about 30,000 shigellosis cases a year. It's not that much, but it's pretty severe condition that often requires hospitalization and antibiotic treatment. Now, Salmonella, shown here, okay, is, first of all, it's a taxonomical nightmare. For a long time, there were several species that were then reclassified into two species. But inside of each species, there are different serogroups, and it's a mess. So, for instance, we have still old reference in our lab, Salmonella typhimurium. It's not Salmonella typhimurium. It's Salmonella enterica serovar typhi. So, taxonomical nightmare. Anyway, just like Shigella, it's the fecally orally transmitted disease, contaminates food. Usually, Salmonella is acquired from eggs and then can be transmitted to other people by fecal contamination. So this is why, it's not recommended to eat raw chicken or raw eggs. In fact, as far as I know, in England, chicken are vaccinated against Salmonella, so the rates of salmonellosis are much lower, and eggs are pretty much stored at the regular temperature. We put them in the fridge to prevent the possible growth of Salmonella. There are two main forms of Salmonella: a fever, typhoid, paratyphoid, and enteritis. Enteritis is considered to be a mild form. It's the person who had salmonellosis once in my life. When I was 9, I can tell you if that's mild, I don't want to think about typhoid fever. You run a fever, you vomiting, you have diarrhea for 2 days, you cannot step farther than 3 feet from the toilet. It's absolutely terrible. Okay. In many cases, salmonellosis, the enteric form, can be self-limiting. Okay. I mean, antibiotics help, especially if they are administered early, but it can be self-limiting. Now, typhoid and paratyphoid forms, they manifest as a systemic infection with involvement of the liver, spleen. They may actually spread to the bone marrow. And typhoid fever is a life-threatening condition. In fact, it's pretty common in Asia, in the areas like India and Pakistan. So typhoid fever is a huge problem there. And on top of that, the problem is that Salmonella in those regions has become pretty antibiotic resistant. So traditional treatment approaches, such as Bactrim, are less and less effective anymore. The main affordable treatment for typhoid fever in Pakistan and India is azithromycin, Z-Pak, that as we know it. But it turns out that Salmonella kind of becomes more and more resistant even to azithromycin. Now, there are efforts to develop the vaccine, although these efforts haven't come to any fruition yet. But there are efforts to make a vaccine because then it would solve a lot of problems. Now, interesting story about Salmonella is that it can be carried asymptomatically. So it's going to be basically in the famous Typhoid Mary, Salmonella was not an infectious agent. It was a part of her normal gut microbiome. Now, I don't remember all the details, like chronological details. She was a cook. I don't even remember her last name. She was a cook. She was from Ireland. She worked in New York. She was a good cook. And pretty soon, health authorities noticed that in the houses where she worked as a cook, people acquired salmonellosis and were very, very sick and hospitalized and whatnot. So they tested her, found Salmonella, banned her from working as a cook. And she worked as a laundress for a while, but it was not paid well, so she returned back to working as a cook. There's no central database or something. And no wonder all these events started again. She was, I don't know how to say it. I don't want to use the word apprehended. She was put in the quarantine second time, this time for the rest of her life. And she lived the rest of her life. I think it's North Brother Island in Hudson Bay in New York. They had special quarantine facility there. Total toll was something 50 plus people got sick, and I believe 3 people died. It's the result of salmonellosis that she transmitted. So that gives you an example of asymptomatic carrier, the disease like Salmonella, that we consider to be a primary pathogen. And in fact, even now, if you acquire Salmonella, and I think I mentioned it, if you acquire Salmonella when you travel abroad, and you have salmonellosis while you are abroad, and you come home, you have to keep in mind that after the resolution of symptoms, you will be shedding Salmonella for 2 or 3 weeks. So you have to be extra careful if you come home during these 2 weeks. Does that make sense? Now we're gradually climbing on the grade of more and more notorious pathogens. And this one is genus Vibrio. Okay? So what is common for all microorganisms in that genus is that they all inhabit brackish waters, okay? And by brackish, I don't necessarily mean dirty. They have to be somewhat salty, okay? They don't like, they wouldn't live in the Dead Sea, okay? But Vibrio is commonly found in estuaries where, rivers meet ocean, for instance. Now, two species that I want to talk about are pathogenic, but there are a lot of absolutely benign species, non-pathogenic species of Vibrio, and some of them, I don't remember the name of that species. There is one species absolutely fantastic. It is a symbiont of some small arthropods in the ocean. And during the night, that Vibrio starts to fluoresce, and arthropods start to fluoresce from the bottom. So predators that look up at those arthropods, they consider them as the part of the night sky. And that's the kind of a protection that they use. It's absolutely incredible kind of symbiosis that provides a mimicry or, I don't know, protective cover, cloaking for other microorganisms, one of the symbionts. Anyway, pathogenic ones. First one is Vibrio Vulnificus. So, well, first of all, you can grow Vibrio on the plate. They're non-fastidious. They facultative anaerobes, can grow in the presence of oxygen. Now, Vibrio Vulnificus is a pretty notorious microorganism that can cause wound infections. Okay? Since it's found in salty waters, it's a fairly common cause of wound infections in people like surfers that expose themselves to salty waters for a long time, and they also are prone to different injuries with a broken skin and so on and so forth. So, very rapid development. Mortality rate is very high. It spreads systemically through the wound. And in untreated cases or in late treatment, as you can see, mortality rate can be up to 50%. Although antibiotics help tremendously. Now, the pathogen that affects way more people than surfers is Vibrio Cholerae. The map from WHO website shows you the geographical distribution of the reported cholera outbreaks in the world. And you can see that these outbreaks are associated with the developing countries. Okay? Central Africa, India, southern tip of Arabian Peninsula, meaning mainly Yemen, some local outbreak in China, Southeast Asia, like Papua New Guinea. So what is Vibrio Cholerae? What kind of disease does it cause? And how is it transmitted? The transmission is with contaminated water. That's the main one. I mean, you can acquire Vibrio Cholerae with a shellfish, but the main transmission route for large outbreaks in the Central Africa, there's not many shellfish, to be honest. So transmission is with contaminated water, fecal oral. Does that make sense? Now, it causes profuse watery diarrhea, okay? So-called rice stool, okay? Now, the treatment actually for cholera is the replenishment of fluids. I mean, there is antibiotic treatment, but people that die from cholera, they usually die of dehydration, of shock, okay? So sometimes this picture shows you the cholera hospital. I believe it's in India. And you can imagine, there aren't very many options. They often lack the basic medical supplies like IV bags. So by itself, the basic treatment for cholera is a problem. Okay. Now, why water spread is problematic? Why can it cause the outbreaks in developing countries, but there are no cholera outbreaks in the United States, for instance. Toilets. We have proper sanitation. All our waste is flushed and centrally collected at water treatment plants, and water is cleared, and human waste never gets in contact with the groundwater. Or if it does, it's like solution to pollution is dilution, you know. Now, in developing countries, there's an outhouse, and there is a pit at the bottom of that outhouse, and all human waste goes into that pit, and then it filters through the ground and gets into the groundwater, and then people drink this water. Okay? And that's the outbreak. For instance, we'll get to the first epidemiological study associated with cholera. So infectious dose is really high, but people drink a lot of water. Does that make sense? And one of the most common places where cholera outbreaks occur is India. This image shows you some local river in India. You can see that it's not the cleanest place of all. And if you think about one of the major water sources for many large Indian cities, the Gang River. Gang River is used for virtually everything, from drinking and washing clothes to, it's a water source for cattle, and also a cemetery where people get buried if their relatives cannot afford the proper burning ritual, okay? So you can imagine that this kind of water source is plagued by all kinds of intestinal pathogens, including cholera. Now, what would be a perfect preventative measure? Boil water, right? You boil the water, cholera is not resistant microorganism, it will die. The main problem is that for boiling, you have to have a source of fire, you have to have firewood, and you need firewood to cook food, not to boil water. You can't afford that. So people drink just collect water from somewhere. So how can you maybe not prevent, but at least reduce the number of cholera cases in the poor neighborhoods in India, where people cannot afford drinking water and where there is no central water supply? So people collect water from, water wells. Huh? Any ideas? Filtration. Now, the idea of filtration is, kind of lies on the surface, but what kind of filter you can implement that people can afford? Well, it was shown that 4 times folded sari cloth, Indian women, they wear this type of dress that is made of, I think it's cotton-made cloth. It's called sari. So if you take this cloth, fold it 4 times, filter your water, you can drink it, and it's much safer. It's not 100% safe, but it's much safer. Now, what's the secret? How does this filtration work? Do you think it contains the bacteria themselves? Think about clothes. Like, look at clothing. It shouldn't, right? It's not fine enough. So what happens? Yes.
I would say 4 times folded, though. You're looking at layers, so it would catch more.
Yeah, but not all, and definitely wouldn't catch the individual cells. They're pretty small. Yeah. Like they less than a micrometer.
Is there something in the cloth that the microbes like?
Something in the water. Can you walk through that door? Can you walk through that door if you're riding an elephant? No. I mean, it's not going to be a door anymore. Huh? You can't walk through the door if you're riding an elephant or driving a car, right? So what happens, turns out, this bacteria hitches a ride in the water. The main transmission route for cholera is not the consumption of free bacteria, but bacteria bound to tiny little arthropods called copypods. Remember we looked at algae, and you saw these little fellas swimming around, like Daphnia? So bacteria hitch a ride on those little tiny animals. And when you filter your water through sari cloth, you remove those animals and bacteria with them. Sure, some of the cells, free cells, will go through, but that filtration reduces the concentration of bacteria so much that you run much less risk for, acquiring the actual infectious dose. Does that make sense? There are international efforts on the development of vaccine. It's basically developed. It went through phase 1, phase 2, and I'm not sure about phase 3, but in phase 1 and phase 2 it showed that it's super safe and it's very effective. Does that make sense? Now, I didn't mention that's one of the virulence factors that you need to know, so I will introduce you to the virulence factor of cholera toxin, the mechanism that it employs to cause diarrhea. Cholera toxin binds and activates the enzyme called adenylate cyclase. Adenylate cyclase produces a signaling molecule called cyclic AMP. Cyclic AMP regulates a bunch of channels, and it closes the channels that are responsible for the transport of potassium. And potassium stays in the digestive tract. Water follows, in this case, potassium by osmosis, and you've got profuse diarrhea. Does that make sense? I think it's extremely elegant. Oh, by the way, remember we talked about how Salmonella can be asymptomatically carried? Can it happen to cholera? Well, if I ask you this question and I mention Salmonella, the answer is probably yes. It was a very interesting story that happened in Haiti shortly after the devastating earthquake that this country experienced. As you know, after that earthquake, the world, the community of all countries, they sent relief and aid teams to help with, basic needs, to help restore buildings, stabilize the life of those poor fellas and whatnot. And one of those countries was Nepal, a relatively large country north of India. Okay, they sent the military who were trained to kind of help rebuilding the city and, provide basic care, medical care, and so on and so forth. And shortly after that, those military arrived, there was an outbreak of cholera in Haiti, in Port-au-Prince. And then scientists got involved and they started to study, and it turned out that those folks from Nepal, they were asymptomatic carriers of cholera. Since the city was basically erased from the face of Earth, they didn't have any proper sanitary system, so even aid workers used outhouses. Cholera got into the groundwaters. Groundwaters were used for drinking, and the only folks that got sick are locals because they didn't boil water, they didn't have funds, they didn't have, firewood, anything. So that was a pretty interesting story, and they clearly identified that cholera that was infecting locals was matching the guys from Nepal. Now that I consider that kind of a climax in the conversation about gram-negative bacteria. So I'm going to talk about from the most boring to the least boring. We're going to start with Yersinia enterocolitica. I don't want to say that it's boring, okay? So as you can guess from the name, enterocolitica, it causes enterocolitis. It's a digestive pathogen that causes chronic diarrhea. Usually it is acquired from contaminated food. It can be acquired from animals. It's pretty common in animals. And there were cases of transmission via blood products, the blood transfusion. So Yersinia enterocolitica is what's sometimes referred to as orphan disease or neglected disease, meaning that we don't really appreciate the importance of that infection, and it's not on our first, 20 possible causes list. You know what I'm talking about? There was a story when a woman in the United States, she adopted a child, a neglected child from the family that basically didn't take care of the kid. And 6-month-old kid was sleeping on the floor in the room next to dogs and cats, and it was like a mess. So she adopted him, and the kid developed diarrhea, and nobody could identify the cause. Okay? And he got treated with various antibiotics. It didn't work, you know. So what's going on? Eventually, she did some research and found, among other possible causes for diarrhea, Yersinia enterocolitica. She went to the doctor. They tested the kid for Yersinia, positive, prescribed very specific antibiotic. He got cured. So meaning that doctors don't think of this infection as, you know, the primary possible source of diarrhea. Does that make sense? Now, another interesting disease here is Francisella tularensis, causative agent of tularemia. So tularemia is transmitted via direct contact. Usually people acquire it when they skin a rabbit that they killed during the hunt. Sometimes it is referred to as rabbit fever. So this is the cutaneous form of tularemia, the wound on the skin. It can spread from the skin to the lymph nodes and to the lungs. And if it spreads to the lungs, the patient can become the source of the respiratory pneumonic form. Okay? Pneumonic form of tularemia and systemic form of tularemia have pretty high mortality rate, about 50%, but they're treatable with antibiotics and timely diagnosis. Now, can you acquire pneumonic form of tularemia without being in contact with the sick person? Curiously, the answer is yes. There were examples of pulmonary tularemia in the United States when people mowed the lawns. So they either ran the rabbit over or they had a dead rabbit, and they just basically vaporized it with a lawnmower and vaporized tularemia with it, inhalation of the aerosol, infection of the lungs. Interesting thing about tularemia is that at some point it was considered to be a potential biological warfare agent. And allegedly, Soviet troops used tularemia as the biological warfare agent against Nazi troops during the siege of Stalingrad. There is an actual report of the tularemia outbreak in the Nazi troops. The siege of Stalingrad, it's all very concentrated in one place. Siege of Stalingrad was a huge mess, so I don't know how much of it was intentional distribution of tularemia by Russian troops, how much of that was it's zoonotic disease. They may have run into some kind of a local focus of tularemia, you know. It's a BSL-3 pathogen, by the way. You can get vaccine if you work with it. And finally, the plague. Causative agent is Yersinia pestis, gram-negative. Yeah, I think it's aerobic. Yeah, gram-negative aerobic or facultatively anaerobic microorganism. Transmission route is quite fascinating, so I want to talk about it a little bit more. Plague is transmitted in rodents by fleas. This is called Sylvatic Cycle. Sylvatic, the word Sylvatic, refers to the transmission in nature between animals. Does that make sense? So you have fleas that bite one rodent, jump on another rodent, bite that another rodent, the disease gets transmitted. Does that make sense? Transmission to humans. In medieval times, fleas directly jumped from rodents, which were everywhere in the city, to the humans. Okay? Fleas bit humans, transmitted plague. Now we have about 2 to 4 cases of plague in the United States every year in the Southwest. However, it climbs up a little bit up north. The latest, most northern case was recorded in Idaho when a boy got infected with plague. So how it happens? Either kids chase rodents and try to catch them and so on and so forth, or semi-feral dogs, you know what I'm talking about, like dogs that live on the ranch, for instance. They will chase a groundhog, flea will jump on the dog, from the dog will jump on a person, bite, plague. It's very rare. So upon that infection by flea, people develop what is called bubonic plague. So bubonic plague is characterized by inflammation and necrosis of the lymph nodes adjacent to the site of the bite, usually inguinal and axillary lymph nodes in the groin and in the armpits. The lymph node becomes swollen and black in color. The mortality rate of untreated bubonic plague is about 70%. Now, some people with bubonic plague, well, actually many of them, microorganism ends up in the lungs. Okay? And that facilitates respiratory transmission. The pulmonary form or pneumonic form of the plague is much more deadly, about 90%. Okay? And septicemic plague, shown here, when microorganisms starts to replicate everywhere, the mortality rate for septicemic plague is basically 100% if untreated. Now, a few things about, first of all, the story of our relationships with plague in Europe. The first epidemic outbreak of plague happened in Europe around 14th century, if my memory serves me well. I believe it was like 1330 something. Now, where it came from, it is still unknown. The legend has it that it was some Arabic military that were sieging Venice, and Venice didn't want to submit, and then they started to throw their dead beyond the city walls. If you consider that Venice is on the water, I doubt there are any walls in the Venice, so it sounds kind of iffy. There was similar story about some steppe city where steppe tribes were sieging the city there and throwing their dead into the city so everybody would get infected. We don't know. Most likely, really most likely, is that plague was brought to Europe by trade. There were a lot of Arabic and Chinese tradesmen that were coming to Europe to sell the goods, and they could easily bring rats and infected animals and so on and so forth. But it is true, and most likely, yes, it is likely that Venice suffered from plague as one of the first cities. Because of the trade, rats from the sheeps basically landed in Venice and spread the disease there first. This is where the word quarantine comes from. When smart people identify that it's most likely, they didn't know the word infectious disease, but can be transmitted, they implemented a 40-day incubation period for all the sheeps that come in Venice. So they would have to spend 40 days, which in Italian is something like quaranto, in the harbor. Well, hoping that everybody who's sick will die over that time. Okay? And that's where the word quarantine comes from. So that first outbreak was pretty bad. Minimum a third of European population died.
I actually was going over this in history. There was one before that, and it wasn't as bad.
In Rome,
Um,
most likely.
Not in Rome. It occurred. I'm trying to remember the city's name. Constantinople.
Oh, yeah. Yeah.
It occurred there first, and then years later, during the Middle Ages, it occurred again and was worse. And they were pretty sure, not 100% sure, it came from China.
Yeah, there are still several plague, how to say, places in the world. You know what I'm talking about? Like, you can find locations in the world where there is plague. Like in the United States, it's Southwest. In Russia, it's near Volga River. In Kazakhstan, there's a huge place where there's plague in rodents. Okay. Now, so most likely what made the Constantinople outbreak more local? Lack of communication. What made that European outbreak that bad? Migration of people. You know, but interestingly enough, that outbreak killed the majority of folks that were overly sensitive to that infection. So next outbreak, which happened, as far as I remember, in 17th century, killed just about 15%. And then one at the end of 18th, early 19th, it was like less than 1 or like 5%. Not much, you know, compared to the original one. In Britain, some historians say that in Britain it killed about half the population of the country. You know, quite a lot. Anyway, so outbreaks of plague still happen. The biggest one that happened recently was in Madagascar. They had something like 200 deaths and thousands of people got infected, and they actually had a pneumonic form of the disease. Okay? So, now, in the United States, as I mentioned, this disease is very common, well, very common. Common in the Southwest, right? Now, if you look, I know, this map is really, really small. But if you would look at this map closer, I don't know if I can do it. No, I can't. Anyway, if you would look at this map closer, you will see something really interesting. There's one little dot right here at the southern tip of Lake Michigan. In the city of, it's a big city, southern tip of the Lake Michigan, huh? Chicago, yeah. Yeah, there was one case of plague in Chicago. You say, holy crap, in Chicago? How could it happen? It's actually a great story. Actual story, you can find it in Morbidity and Mortality Weekly Reports. It's a publication of CDC. So one wonderful day, I don't remember if it was spring or summer or fall, a gentleman in his 50s comes into the emergency room and says, I kind of feel iffy. Fever, feel terrible. The doctor evaluates him and says, no signs of any bacterial infection. Probably just sick. Just go home, take some ibuprofen, tough it out. So next day, that same dude is brought to the emergency room by ambulance. And he's running terrible fever. He's totally confused. Like, he's doing really bad. So they put him on broad-spectrum antibiotics. As far as I remember, they put him on Vanco and tetracycline to cover all bases. And they took the blood for cultures. Sent it for cultures. 24 hours later, that fella died. And 24 hours later, the cultures came. Had plague. In Chicago. No animal contact, as far as they know, whatsoever. So they started to investigate. He was a professor of microbiology at University of Illinois, as far as I remember. And he was working with, guess what? Plague. But he was working with a vaccine strain, which shouldn't infect people, you know, or shouldn't cause the disease. He worked with well-known attenuated strain of plague. So he didn't use gloves, obviously, when he was working. Probably thought that he's experienced enough not to. So they started to dig deeper to see why this particular gentleman got so sick that he died of the vaccine strain. And they found that in addition to acute plague, this fella had chronic condition called hemochromatosis, which is abnormally high levels of iron in the blood. And plague loves iron. When there's iron available, it replicates like crazy. So he basically got overwhelmed by otherwise attenuated strain. Well, the good thing is that we know now that this attenuated strain becomes pathogenic, becomes virulent in people with hemochromatosis. Does that make sense? I just love this story. Now, these 3 gram-negatives, Pseudomonas, Legionella, Haemophilus, all are primary pathogens in humans, and we're going to start with Pseudomonas aeruginosa. So it's the environmental microorganism, but it's commonly found in the hospital settings. And nosocomial transmission of Pseudomonas is very common. It has a whole bunch of virulence factors. And of these virulence factors, I want to highlight only one. Drug resistance. Pseudomonas is notoriously drug resistant. It's resistant to virtually anything, okay? Largely due to the fact that it's one of the main opportunistic pathogens in patients with cystic fibrosis. For a long time, if the patient with cystic fibrosis would test positive for Pseudomonas aeruginosa, this patient would be put on broad-spectrum antibiotics immediately. And that constant treatment with broad-spectrum antibiotics facilitated the development of multi-drug and totally drug-resistant strains of Pseudomonas. It's so bad that there are cases now when patients with cystic fibrosis develop pneumonia that doctors cannot treat because the strains are absolutely, totally 100% resistant. That make sense? Now, we kind of started with a really bad disease, the pneumonia, but Pseudomonas can cause infections in folks without any suppression of the immune system. So they have lovely names. For instance, green nail syndrome. Okay. This one. Or hot tub rash. It's an official name. Now, hot tub rash is disease. It's basically a cutaneous infection that can develop into a condition known as erythema gangrenosum. So gangrenous lesions on the skin. And erythema gangrenosum, if it's not treated, can further progress into the necrotizing fasciitis, which will probably lead to death. Okay. Now, characteristic appearance of Pseudomonas aeruginosa on the agar, it's green. It's green because of the pigment and virulence factor called pyocyanin. So you can fairly easily distinguish growth of Pseudomonas versus growth of other microorganisms. Legionella pneumophila takes a lot of attention. I don't want to say that it's undeserved attention, but I would say that if we consider the risks associated with legionellosis, it's not really well justified. So this microorganism was first isolated as the human pathogen during the meeting of American Legion, I believe in 1976, somewhere at that time. So a bunch of folks at that meeting fell ill with atypical pneumonia, okay, which was pretty severe. The autopsies identified the possible culprit, a pathogen, a bacillus, that had very characteristic intracellular intramacrophage growth. So Legionella, as it was later called, somehow invaded the lungs, and in the lungs infected alveolar macrophages. Now, further research identifies Legionella as the primary pathogen of amoeba. Okay? This bacteria normally infects amoebic cells, replicates in the amoeba, and it's not a normal pathogen of humans. However, when it is accidentally inhaled, the cells that are closest to amoeba in the human lungs are macrophages, so it infects macrophages. Does that make sense? Now, how those folks, the American Legion, how did they get the Legionella infection? It turned out that air conditioning system in the building where they had a meeting was old, and there was water in the ventilation ducts, okay? And that water was a rich medium for amoebic growth. So air conditioning system vaporized, pulverized the water with amoeba in it. Those fellows inhaled amoeba. Legionella jumped from amoeba to macrophages and infected, caused pneumonia. Every year you can hear about the cases of legionellosis associated mainly with the water cooling towers. Water gets pulverized, people inhale it, develop the disease. It's absolutely treatable, proper diagnosis. There were some cases of legionellosis at Cedar Point last year. Everywhere there is a vaporized water, you're going to have legionellosis. Okay? Haemophilus influenza, along with Streptococcus pneumonia and Neisseria meningitidis, one of three main causes of meningitis, community-acquired meningitis. It's a fastidious microorganism, grows on the blood agar or chocolate agar, and it causes meningitis. It can persist in the upper respiratory tract. It can cause mild infections, for instance, middle ear infection. Okay? But, of course, the main risk that we're running with Haemophilus influenza is meningitis. This is why we have a vaccine. Okay? And there's actually a trifecta, so three microorganisms that cause community-acquired meningitis: strep pneumonia, meningococcus, and Haemophilus influenza. Thankfully, we have vaccines against all three. Does that make sense? So, you're required to take these vaccines if you go to school in Ohio. H. pylori is the gram-negative microorganism that causes gastric ulcer. Okay? You've heard about it, I guess. So, this is a normal stomach. This is the stomach with an ulcer. So this microorganism, when it enters the acidic environment of the stomach, it neutralizes acid and liquefies the mucus. That allows it to survive in the acidic environment and penetrate through the mucus all the way to the epithelial layer, where it establishes the infection. Okay? That infection leads to the inflammation. Inflammation leads to the disruption of tissues, and that's the ulcer. Am I clear? Now, the older you are, the higher the colonization rates in your environment, in your population, your age population. On top of the regular ulcer, it can cause gastritis, and peptic ulcer caused by Helicobacter pylori is associated with a B-cell lymphoma of the stomach, so basically with one of the forms of the stomach cancer. Now, interesting thing is that H. pylori was shown to be negatively associated with the carcinomas of esophagus, and it was shown very clearly that children who have early colonization with H. pylori have a lower risk for developing asthma. We don't know the mechanism, but it's a pretty convincing evidence. Yeah. So if a child is colonized with H. pylori early in life, less likely that this child will develop asthma. Now, how do we know that H. pylori causes peptic ulcer? So, two things. First, the whole story of discovery, when Marshall and Warren noticed that H. pylori is associated with peptic ulcers. So they tried for a long time, they tried to cultivate this microorganism. They finally figured out that it's microaerophilic and capnophilic and managed to recreate the proper environment for it. Second, they still, you have a microorganism and it doesn't cause any peptic ulcer in mice, so how do you prove? I believe it was Marshall who actually drank a beaker of H. pylori culture, and then a few days later he developed all clinical symptoms and signs of peptic ulcer. On top of that, they did a biopsy of his stomach, and it was textbook peptic ulcer. So it was N of 1, but he kind of fulfilled Koch's postulates. And later, massive evidence showed that colonization with H. pylori precedes the development of peptic ulcer. And on top of that, treatment. Peptic ulcer it used to be treated with omeprazole, the proton pump inhibitor. And it reduced the symptoms, but it did not cure ulcer. When a variety of antibiotics is added to omeprazole, so omeprazole reduces pH, reduces acidity, it increases pH. And antibiotics will take care of the H. pylori. Peptic ulcer can be cured. Okay? Now, this map shows you the prevalence of H. pylori. I think it's pretty interesting. A lot of it is just no data. But you see that it's vastly prevalent. A huge problem in Russia. Okay? Asia. Some countries in Europe that report it. You can also see that, generally speaking, developed countries have lower rates of H. pylori colonization. Probably because, it's diagnosed early and treated early. And I believe in Africa, Central African Republic, peptic ulcer or H. pylori, being positive for H. pylori, is probably the least of the problems that they can face. Now, these three. So we talked about gram-negatives, right? And I told you that you need to know gram-negatives, gram-positives. So these are called spirochetes. These three microorganisms. And spirochetes belong to a special group of microorganisms. We're talking about the cell wall structure that are called diderm bacteria. So they neither gram-positive nor gram-negative. Is that clear? They neither. And the first one, the boring one, Leptospirosis interrogans. Chances are you're not going to see anyone with leptospirosis unless that's the person who lives in very rural conditions on the farm and is in constant contact with animals, and these animals can be exposed to wild animals. Leptospirosis is zoonotic disease. Okay? When people get exposed to the urine, to the water contaminated with urine, and urine comes from dogs or other domestic animals, then the person can develop leptospirosis. Usually in immunocompetent people, disease is mild, just a fever. Okay, with proper treatment, it's curable. In people who are immunocompromised, it can be severe, leading to vasculitis and liver and kidney failure, so-called whale syndrome. Okay. Now, in my ranking of exciting microorganisms, Borrelia burgdorferi definitely trumps Leptospirosis interrogans. Borrelia is the causative agent of Lyme disease. Okay, so the name Lyme disease is given after the town of Lyme in the state of Connecticut, where this disease was first described. So Borrelia burgdorferi, shown here on this fluorescent micrograph, is transmitted by ticks. So when you walk around, tick, I believe those are larvae or nymphs. Yeah, I think those are larvae, okay? They sit on the grass, and if you walk by them, they will not jump, they will basically attach to your clothing, and then ticks will climb into some dark and humid place, which is most likely going to be your armpits, your groin, or your head. Okay, sometimes they bite in the most unimaginable places. One of the unimaginable places is an eyelid. Okay, we had a neighbor, when we had a country house in Russia, neighbor who had a tick in her eyelid. She didn't really feel anything, it was just inconvenient. We tried to extract the tick by putting oil on it. You know that if you put oil, supposedly they start to suffocate. I don't know, I cannot tell for all the ticks, but that fella did not. We could fry it. It was so oily. By then, we spent 40 minutes trying to get it out. Eventually, our neighbor said, to hell with it. She was an alcoholic, so probably tick just died of the cirrhosis. Yeah, it was just, we met her like 3 days later. Where's the tick? I don't know. Just popped out. And said, probably dead. So, seriously speaking, if you notice a tick, well, first you have to check if it's engorged or not engorged. If it's a small one yet, means that it didn't had any blood meal yet. So you have a couple of options. I've heard that if you put something like Vaseline or petroleum jelly on it, it will climb out. Never tried. We did just hand removal. You have to be careful though, so the head doesn't stay in the wound. Some people say you can do a loop, like a thread loop, and try to pull it out with a loop. Never tried the loop.
They make like little tick removers for pets.
Okay.
It's kind of little, you just like
Pull it. Yep. The best way to prevent it is just to wear proper clothing when you go to the forest. So your pants should be tucked in your socks. Your t-shirt, well, not t-shirt, long sleeve shirt, in your pants, and spray yourself with DEET. It'll work. Okay. I'm in tick-infested areas. Definitely not Ohio. There are places back home in Siberia where a number of ticks and may so high, people use brushes to remove them from clothing. Like, yeah, like brush them off. So talking hundreds. Okay. Now, when tick takes a blood meal, it transmits the microorganism from salivary glands into the blood. And the first sign of Borrelia infection, so-called bullseye rash. If you see this, it's also called erythema migrans. If you see that somewhere in your body, go to the doctor. That's the sign of Borrelia infection. You are about to develop Lyme disease. Okay? They will prescribe antibiotics and you'll be fine. If you don't go to the doctor, it may lead to second stage. In second stage borreliosis is characterized by a variety of neurological symptoms as terrible as meningitis, okay, and arthritic symptoms. So joint pain. The problem with that second stage, two problems. One, that chronic disseminated second stage borreliosis is terribly hard to treat. We're talking about months of antibiotics. And on top of that, even if you clear the bacteria, you may still have the symptoms for the rest of your life. So the damage is permanent. You know, so just protect yourself from ticks by dressing properly. Right? Now, the fun stuff. Syphilis. Caused by Treponema Pallidum. So Treponema causes most known disease is syphilis. There are milder forms, Bejel and yaws, that do not cause such a bad disease. Allegedly, this disease was brought to Europe by conquistadors that acquired it in the United States. So I usually say that it was kind of fair trade. Europeans gave them smallpox and measles, they gave Europeans syphilis. This idea now is questioned because there's evidence of the disease that looks like syphilis, similar like Bejel, but it was found in Saudi Arabia before colonization of both Americas. So we still don't know where it originally came from. Now, that microorganism, Treponema Pallidum, see, spirochete, is sexually transmitted disease. Now, I have to be very clear about it. It's sexually transmitted disease. You're not going to get syphilis if you touch a person, if you hug a person, even if you kiss a person with syphilis. The only examples of non-sexual transmission of syphilis is sharing a towel, which I kind of can imagine, but people have to be close. And second example, which actually happened, sharing underwear. That level of personal proximity I cannot imagine, but somebody did, okay? So basically what happened, if you think about it, there was a mucosal exposure. So mucosa touches a towel, towel touches another mucosa. Yes, you can do that. But, you know, people normally do not walk around and touch each other genital mucosa, like, and then theirs, like randomly. So it's kind of fairly intimate process. Anyway, so it's sexually transmitted disease, and it has three stages: primary, secondary, and tertiary syphilis. Primary syphilis is characterized by a common symptom, sign, called a chancre. Okay? Chancre is fairly noticeable in males due to the genital anatomy. In females, it can be kind of hidden. Okay? Usually it's painless. Okay? It's not itchy. So people may not notice it. And then if primary syphilis is not treated, and it's treated easily with penicillin and tetracycline, now there are more and more penicillin-resistant strains of syphilis, but still syphilis is absolutely treatable. Okay, so it goes into the secondary syphilis. The common symptom of secondary syphilis is mucocutaneous rash, meaning rash in the skin and in the mucosal membranes all over the body, and fever, like flu-like symptoms. A little sort of disclaimer. So those symptoms, flu-like and rash, are common in people with secondary syphilis. But if you would Google, you know, secondary syphilis signs, that will be a huge variety. It can be virtually anything, mostly focused around genitals. And my only question in this case, I had a chance to glance through the book for medical professionals, for the doctors, that it was called, you know, like secondary syphilis, symptoms, signs, treatment, prevention, something like that. And they had a lot of photographs of actual patients, what can be a sign of the secondary syphilis, what can be a pathology. And I look at those photographs and I think to myself, do you have a mirror? Because if that's down there in your pants, that's not normal. Like, that's not gonna heal. That black thing is not gonna heal, no. And if you, like, do you ever, like, look down, like, to check? It's ridiculous what people think, oh, it's gonna be fine. You know. So there's a wide variety of symptoms. Now, primary and secondary syphilis are both infectious. So the person can transmit the disease during these stages. Now, tertiary syphilis is non-infectious. In this case, microorganism spreads systemically. Okay. Now, there are examples of neurosyphilis. You may remember we had a brief mention of neurosyphilis when we talk in AP1 when we talk about reflexes, and we talk about stretch knee-jerk reflex. In neurosyphilis, knee-jerk reflex is gone because of the damage to the spinal cord. It can affect heart. In cardiovascular system, very common sign of tertiary syphilis is aortic aneurysm. It infects the walls of aorta. But perhaps the most notorious site of syphilis infection is connective tissue. So this damage to the connective tissue on the nose is called a gumma, G-U-M-M-A. Okay? So gummas can be, I don't want to say benign, but can be not notoriously terrible. Okay, like this. It's basically a destruction of the skin and underlying connective tissue. And in some cases, the whole parts of the tissue are gone. If you will look up images for the search of tertiary syphilis, you will be amazed at the level of damage that people experience with the tertiary syphilis. The entire nose, well, except for the bony part. So, perpendicular plate of the ethmoid and vomer stay there, but the entire cartilaginous septum, ala, bridge, they're all gone. Okay, they just destroyed. So tertiary syphilis is terrible, and at this point, I mean, you can treat it, but the damage is done. Does that make sense? Now, again, it's treatable, and prevention is sexual hygiene. It's sexually transmitted disease. Now, that concludes the conversation about the bacteria, and I have to talk about fungi. I really don't want to. I don't like fungi, to be honest. So, well, let's talk general stuff a little bit, just a little bit. No, I can't skip. No, I can't. No. You will be dealing with some fungal infections, mostly cutaneous. But. So, three main types of fungi based on the mode of growth. Molds, which are colonial multicellular fungi, shown at the bottom. The left and the center pictures, molds. They transmitted by, reproduce by spores. Spores can be sexual and asexual. They also can be transmitted by simple fragmentation of these branches that are called hyphae. Okay. Yeasts. Yeasts are unicellular. Okay. They reproduce by budding. You can see buds of yeasts here. Okay. Or spores. Or dimorphic fungi. Dimorphic fungi grow as molds in the environment, okay, and as yeasts in a human organism. Most likely that happens because of the temperature difference. If you think about it, the environment, like the forest, the ambient temperature is mid-70s, 80s, right? And human body is almost 100. So the temperature difference probably is what modulating the growth of dimorphic fungi. Now, few structural aspects. You all have seen mold in the bread, in the fruits, right? So how does it look?
Fuzzy.
Fuzzy. So that fuzzy appearance is called mycelium. And mycelium is basically the mass of thread-like structures called hyphae. Hyphae can be vegetative. These are the ones, say if you look at the mold that grows on the bread, vegetative hyphae are in the bread. They produce exoenzymes that destroy the organics, so organic compounds can fuse into the cells. And some hyphae are reproductive, so they produce spores. Okay. Now, in some molds, hyphae are septate, so you see individual cells here, separated by septa. So that's single septum. Or it can be non-septate, where septa are gone, and the hypha basically represents one gigantic multinucleated cell. Does that make sense? Now, if you would look at the yeast, you will see that although they are unicellular organisms that divide and produce new yeast cells, all the new cells tend to stay together. Okay? And they form what is called a pseudohyphae, which looks like a true hyphae of a mold, but it's actually just a bundle of independent yeast cells. Does that make sense? Now, I want to say a couple of words about reproductive strategies, and yeah, we're going to wrap it up. So, how can fungi reproduce? Well, I mentioned that they can reproduce by hyphae fragmentation. So they grow, a part of hyphae falls off, travels to another site, gives rise to a new mycelium. Basically the same way some plants can reproduce. If the part of the plant ends up in a different, area of soil, it can give rise to an entire plant. Like you take a stick, stick it in the soil, sometimes it will start growing as an independent plant. Obviously, hyphae fragmentation is not a sexual reproduction. Basically, make a copy. Make sense? Another way is to produce spores. Spores can be asexual and sexual. So, asexual spores, see here, one example are so-called sporangiospores. This sporangium of the fungus mucor, that can cause pretty severe sinusitis, contains thousands of fungal spores. When sporangium bursts, spores are released. Another type of asexual spores are conidiospores. Basically, those are the spores that pinch off the reproductive hyphae. Like this, conidiospores from Aspergillus. This structure is called conidium. Or conidiospores of the skin pathogen trichophyton. So these are conidiospores, and this whole structure is called macroconidium. Now, asexual spores are normally produced by fungi in the normal environmental conditions. However, when environment becomes challenging, when conditions become harsh, unwelcoming, fungi start to produce sexual spores. For instance, ascospores. You see individual ascospores, and here I cite the packages Alaska spores. So sexual spores are not really common, but as I mentioned, they are produced under harsh environmental conditions. Why sexual spores are produced in the harsh conditions and asexual in the normal conditions? What's the reason, huh? Yes, to increase genetic diversity and increase adaptability to these harsh conditions. Does that make sense? So, if you would look at the life cycle of a typical fungus, there is an asexual component. That's normal fungal growth. And then sometimes it switches to sexual cycle. That's when the fungus is exposed to some unwelcoming stuff. Okay? So, we're going to